Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you the most practical CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Nolan Hennessee. He's CIO and Vice President at St. Joseph's and Candler Health System. Welcome, Nolan.
John, thank you so much. I appreciate that.
Yeah.
Thank you for inviting me in.
Yeah, I appreciate you joining us. We're here at MEDITECH Live Conference. Lots going on here. Of course, at MEDITECH Live, it's an opportunity to be part of the larger MEDITECH community and, meet with your peers. I love that. And, let's talk about partnerships. I understand you're a strong advocate for MEDITECH as your primary health system vendor, as most people, the HR, it's such an important part of your organization. Talk to me about what that looks like for you and what you value in a partnership like the one you have with MEDITECH.
Yeah, I really want to talk about the partnership, John, and I think it's important for everybody just to kind of let me share with you a little bit about our organization so you understand the magnitude of the size. Because St. Joseph Candler Health System is about 715 beds, licensed beds that in Savannah, Georgia. We service a 6-county region.
Okay.
We kind of consider ourselves to be the regional vendor of choice is what we like to think. And it's a very culturally diverse environment in Savannah with the ports there. Second busiest ports on the East Coast. Bryan County, 6th fastest county in the United States growing. We have SCAD there, so you can just, and then obviously we have a lot of tourists that come into town.
Yeah.
So we got a great population that's very diverse, and then we have a lot of transient population in Savannah, Hilton Head, Beaufort, Bluffton area.
Wow, that's quite a mix.
Yeah, it is. But yeah, to your question, as far as I thought about this, as far as in what do we look for in a partner. And really, it's you want a partner that's stable, that you can count on them actually delivering on what they're talking about.
Yep.
And they're going to be here in 5 and 10 years. In the healthcare industry, healthcare IT, a lot of vendors come and go. There's some core players out there, but man, MEDITECH just has that reputation of just being a rock out there. So
over 50 years, 55, I think.
Yeah. So there, I can count on what they say. They don't oversell. They don't undersell. They always deliver. So that's. I could go on and on about that because that kind of defines, how's the relationship even going to get started. So.
Yeah, it reminds me of a CIO I had on once, and he talked about this one vendor. He's like, they're the only one that did what they said. I was like, wow.
That's a drop the mic moment, isn't it? Like enough said.
It was.
Right?
Well, I mean, the drop the mic was that there's so many who overpromise and then can't deliver. So that says a lot about your relationship with MEDITECH that they've been able to do.
Yeah, I've been working with MEDITECH. I started my career on the banking manufacturing side, and then 2000, Y2K, it's like, ooh, let me get off that train. And I got into healthcare, and I've worked with MEDITECH. At my facility and at my previous facility. So I got 25 years of experience of mostly MEDITECH. And just so anecdotally, our facility chose our first EMR in 1997. It was MEDITECH Magic. And our CEO believes in it. And we've stayed the course with it. And we have not been disappointed. So
that's awesome.
Yeah.
Well, I learned that you fast-tracked an Expanse Ambulatory rollout to approximately 100 providers. That's a nice lift.
Yeah, it is.
Talk to me more about that and share about this decision to roll it out there.
Yeah, and I would be remiss if I didn't talk about the reality is anytime I talk about IT lifts, it's operations focused. So if the physicians hadn't gotten on board, if the operational leaders hadn't gotten on board, IT, what I've learned in healthcare, it's not a top-down push like it is in banking.
Sure.
It's more of go out there and can we get everybody excited, everybody informed, everybody educated. So that's kind of what we did. And that's something we started looking at even prior to COVID.
Okay.
We started doing site visits, and then COVID hit, and that changed everybody's world.
Of course.
And the whole one, and you're going to hear me say this a couple times, the whole one patient, one record thing just makes sense to us as we look to be the community service provider.
Sure.
And man, has MEDITECH just expanded upon that view, even from when they started talking about it probably a decade ago as far as Expanse. So yeah, we ripped the Band-Aid off. The good news is we, transitioning EMRs is never fun.
Yeah.
But the good news is you get over that lift and we just found a process that worked for us.
That's great.
And the good news is now is we're on the other side of that. And as MEDITECH continues to add functionality, it's always good as a CIO if they're coming towards you and asking you for technology. You're like, oh, okay.
Yeah.
Versus we're trying to push it. They're like, we don't have time for you. You're going to bother me.
No more.
I'll mention it. We'll probably talk about it again later. But now, like, we've gone forward with Expanse now in our ambulatory space. So now it's starting to just kind of be organic with us. And we'll talk more about Expanse now and what we're going to do on the acute side later on, too.
Yeah, it's interesting what you say that, you know, no one wants to transition EHRs. It is a lot of work to transition EHRs, there's no doubt.
Right.
But, you know, once you get to the other side, I've heard so many people be like, well, why didn't we do this sooner, right? Like,
it is.
You know, the devil you know versus, you know, actually, no, the advantages are so much better. I'm glad I finally did it, right?
It's just healthcare as an industry is tapped out. I mean, everybody's running at 99%.
Yeah.
And then some. So, as we all know, any new technology, whether you get an app on your phone, it takes a few minutes for you to learn it. And the providers, I try to tell folks that come in to talk to them, I'm like, providers didn't go to school to learn IT. They went to school to learn how to treat patients. So every time we bring something towards them, it's a disruption. Very intelligent, obviously, people, but it's like, okay, that tool that you were using yesterday, throw that out and now use this one. And they're like, well, I hate the tool that I already have, but I hate even more moving someplace else. And then you're exactly right, though. Once you get through it, that learning curve, because there's a learning curve, but it's all about taking time away from what they want to do, and they want to treat patients.
Yeah, absolutely. Well, I know you also rolled out Expanse Oncology in your cancer center, your infusion clinics. Tell me more about that rollout and what made that unique.
Yeah, well, we're in the middle of rolling that out. We're doing the build right now. I just got off a call with our CEO, so just understand that just gives you a sense of how important, because Lewis Cancer Research Pavilion is one of our verticals. And just to kind of, again, just to share with you there, that's 50 oncologists.
Okay.
25,000 plus infusions every year.
Lot.
And we have 7 infusion centers, which that's a little bit different, because think about it, it's in healthcare we're faced with customers, you know, they're very dynamic and they want what they want. So that's part of the challenge. The good news is MEDITECH has stepped up to the plate. They're working with us to make sure that it's all going forward. But again, that just ties into what I mentioned earlier, the one patient, one record. You know, so that's a benefit. And sorry if I sound like a commercial from MEDITECH, but that makes sense to me as a consumer, because I'm dealing with some things with my mother. She's elderly and she's going to this specialist and this doctor and this doctor and this doctor, and they aren't part of the same network. So there's always a struggle to get that information. Well, in our region, we have a lot of these subspecialties as well as oncology. And think about an oncology patient. You know, they're going to go to a primary care physician. Great, got it covered. MEDITECH Expanse. Oh, they're going to go to a subspecialist. Great, got it covered, you know, for a subspecialty. Then they're going to end up in the ED. And then they're going to end up in the hospital. And then they're going to end up back over with their oncologist. So it gives all of our providers one-stop shop to see what's going on with that patient, because many times the patient doesn't remember what happened. You know, if you talk to an elderly person, like, hey, you went to the ED. What did they say? They said, I'm fine, go home.
The food was bad. They're like, well, you almost died. Well,
did they change your medication? No. And you're like, oh yeah, they did, right?
Yeah, exactly.
So that's pretty exciting for us to be able to deliver that. You know, the other side of it too, as the world moved towards, you want to empower patients to have their information. Well, think about it. Before, we had one patient portal for the hospital, one patient portal for the ambulatory side, one patient portal for oncology. Now, someone who's really sick, do they really want to deal with all that? And what we're excited about now is collapsing all that into one view so that they can see everything that's going on with their care. Either they or someone they proxy it off to. And that's pretty powerful.
Yeah, there's an ICD-10 code that's called hyperportalosis when you have too many portals. So you're solving that problem for people.
Absolutely.
That's great. I mean, I think it's interesting that you're rolling it out in cancer and oncology, right? Like the advancements there are so quick, right? You know, especially in regards to precision medicine. Talk to us about what you're doing to make sure you're staying ahead with that.
It's what I'm doing. I'll stay ahead with that. But really, here's what I want to give accolades to MEDITECH. They've just picked up the pace. Like I said, I got 25 years of experience with MEDITECH, and MEDITECH has picked up the pace in that their portfolio is becoming more refined quicker. Okay. They still have great partnerships.
Sure.
And they're represented here at MEDITECH Live. And that's something else that I can count on, because there's any number of hundreds, if not thousands, of vendors that are out there, and vendors are very good. But you have to look at the ones that are strategic partners, with MEDITECH. And what I'm seeing out of MEDITECH, I'll just give you an example. When portals became mandated, let's talk about this. You can't talk about what's good without talking with what was bad.
Sure.
The portal that MEDITECH came out with, first generation, just didn't have the curb appeal to it. Wow, have they just blown that up? Yeah. And they're coming forward with such a much better product now. So that's what we like seeing is where we started our conversation is they don't overpromise. They give you solid dates. They say, here's what we're doing and here's when we do it. And I try to push them. I'm like, can you do it sooner? And they're like, no, this is it. And I, being a computer science undergrad, I get that. I'm like, cool, I kind of get it, but I was trying to push you anyway. I get pushed on, so I'm going to pass it on. But they really are expanding their portfolio to more of the forward-facing components that really help us out.
Yeah, so talk to us more about that. I mean, it's great you talk one patient, one record. I think that's valuable for the patient, valuable for everyone involved. But, with your patient population, how are you engaging patients? What tools are you using to kind of boost their satisfaction beyond just, hey, at least it's a consolidated record? That's a huge one. But
yeah, I mean, obviously we're here to talk about technology, and there's a patient population, to my surprise, that there's a patient population that's going to use technology, mHealth, the portal, Patient Connect, things like that. But they're let's just take a little side trip, because there is a population, an indigent population, that's not going to use technology. Now, if you'd asked me 5 years ago, I'd be like, yeah, the elderly people probably aren't going to use technology. Let me just tell you, wrong. Okay, there is a population.
And their kids are going to use it too.
Yeah, absolutely. So you put that there is a elderly population, and they use that. So some of the tools I just mentioned is obviously for your technology-based folks, but then you also have to subscribe to the folks that aren't using technologies. Everybody who works in healthcare knows that when you have an indigent population, a lot of times they use your EDs for their primary care. And that's not good for them, it's not good for us, and it's not about compensation, it's about throughput. If you have someone that's very sick versus someone who's trying to just really see primary care, then we're just clogged up in the ED. So our organization is pretty awesome in that we have several facilities out there that are for indigent care, or when they land in our ED, we try to get them to a medical home, which is within one of our primary cares. And we'll take care of billing and all that stuff later on, but it's more about getting them the care and trying to get them into a provider where if they have chronic illness or something like that, so that it can be managed, so they don't end up back in the ED. But the technology tools are great. The mHealth, Patient Connect, and Expanse now for our providers. We're trialing that with our ambulatory guys.
Interesting.
And we'll talk some more about that, what we're doing with the acute side of it as well. So.
Yeah. Well, you're part of a panel here at MEDITECH Live as well on perfecting care for patients.
Yep.
Love the title. That's
yeah, no pressure there, right?
No pressure.
They got an MD to my right and an RN to my left. I'm like, I'm the technical guy, kind of, sort of.
Well, I mean, ironically, that's kind of what you need to perfect care for patients, right? You
Yeah.
need some clinical, you need some technical.
Yeah.
But talk to us about that. I mean, you're in a pretty interesting environment, as you described. It's rural. You got the urban, you got the transient resort, population as well. Hilton Head you mentioned, right? We're all familiar with that. What are some ways that you're engaging with them, to meet kind of this population health need?
Yeah, it goes to speaking in my lane is we're challenged with access, and we're challenged with appointments, and I think every community hears about that. Is what we're trying to come forward. Think of it, the Amazon experience. Can I say Amazon? Is that okay?
You can say it.
Amazon, okay. When you go on Amazon and you see a shirt there and you're trying to buy a shirt, you expect that shirt is available,
Yep.
and it's going to be delivered.
We take it for granted now, huh?
Absolutely, but that's the culture, and people go, well, that's my expectation. So where I see us going as an organization, and it takes some time.
Sure.
When you start changing culture that says we really want to present them with the app that shows here's your appointments, and hopefully people will stay with their primary care physician, but I'm the customer. And I may choose to go, well, my physician can't see me now, so maybe I'm going to choose to go someplace else.
Sure.
Now, you can appreciate that creates some problems there. But that's the evolution of healthcare. And the other thing of it is showing those appointments as opposed to hey, why don't you just call the office? And we have centralized scheduling, and you can call the office. But most folks want to just look at it. Just show me the appointment. Let me see what works for my schedule versus having this extended conversation. I got kids in the car. I'm trying to check out of.
I can't call you because I'm at work.
Right, or I left you a message and you call me right back at the most inconvenient time.
That's so
I
true.
want to do it. I want to schedule. I want to see what's available, and I want to select it. As to what's good for me. So that's how we're trying to engage them, making it just accessible and show so to speak, show our inventory being appointments. Sure. And give that to them and let them make the choice.
Yeah, I think the reality is they're going to do it whether, the only question is, are we going to make it easier or not?
Yeah,
right?
that's right.
That's where they're headed. Patients are more empowered. So I think that's
they're more empowered, and think about how much, again, this is where the needle has moved as far as like forms. Everybody's had to show up to the doctor's office and they give you the clipboard.
Yeah.
And you spend they tell you to be there 30 minutes before. And again, what we're seeing with MEDITECH is the forms just being embedded as part of that. And we all have the smartphone technology. It's like, cool, I went ahead and put in my name, my address, and my date of birth and all that stuff
Filled it out for you.
so that the forms are submitted and it's electronic.
Yeah.
As opposed to them bringing these forms or completing those forms there, then the nice person at the registration desk sits there and transcribes everything in for you. I'm like, boy, that's so 1990s,
Yeah.
So I'm glad to see that coming forward, more native within MEDITECH.
Yeah, that's awesome. So what's next for St. Joseph's and Candler? Any projects that you're
Oh my
really
gosh!
excited
Well,
about?
I made notes. So
sweet. Now
here we
we're
go.
here.
I mean, truly, I'm excited, and I say that because while it's making a palatable difference. I mean, this is something our CEO can see. We're going to present some of these things to the board here in a couple weeks. But think about mHealth. That's forward-facing, right? I mean, that's in the customer's hands. They got a new portal. We're going live with their new portal in January.
Awesome.
And then Expanse now, we're trialing that right now with our primary care physicians. And then we're going to roll it out to, there's some nuances to the acute side docs, hospital side docs in January. And then oncology, we talked about oncology's coming to May. We didn't talk about BCA, and we're pretty excited about BCA because with DR and MEDITECH, it provides information. Bravo to MEDITECH to go, well, we're going to put this tool on top of it that makes data actionable. Because you can look at something in an Excel spreadsheet and go, okay, that's a number. Is that good or bad? When you see a pie chart, it's like, oh, here's your baseline, and that's where that makes the data more actionable.
That's awesome.
And that's a good place where, bravo to MEDITECH with DR in the fact that we have 4 of the bolt-ons. They do a great job, but they're bolt-ons. Yeah. And here's what if I can go native into MEDITECH, I am.
Right.
And it's going to allow us to displace 4 of the other bolt-ons.
Wow.
That are out there. So it's a cost-effective as well. That's not the driving point,
Sure,
it's
about care, but cost matters.
Yeah, it does, because we're all running a business. Probably the one thing that I hadn't talked about is genomics.
Okay.
And they've been talking about genomics for a long time. And I saw at Muse. Was it Frederick? Was it Frederick? Frederick. Sorry. Frederick, what they had done, and Jackie and those just kind of unpacked it. Because genomics was always, at least from what I understood, it was kind of packaged solely with oncology, which is extremely important.
Sure.
But now the use case of it is going far beyond that of oncology, which again, that's important enough. But as you think about genomics, the price point of getting a genomics test performed,
come way down.
and then the idea of, let's just use a simple example, someone who has high blood pressure. Well, I think there's somewhere around 16 medications for high blood pressure.
Wow.
Years ago, I went to a physician and they said, hey, you know, you kind of get a little, this look like high blood pressure. Let's try this medication and see how you respond. And I said, what do you mean?
That doesn't
I hope
sound like
with lower blood pressure, right? Right. Well, each one of them have side effects. So you start Googling it, you know, and looking at that, and you have to figure out which one is right for your biology.
Right.
As I understand it, I'm not a clinician, but my wife is, so you know she fills me in on this. She's a behavioral psych NP, and you think about the possibilities of going to the physician, and regardless of your condition, getting a medication that's suited for you. Wow, because I can tell you, there's been a number of times in my history where I went back to the physician like, this thing is just not working. You know, they're like, oh well, let's try something else. You know. So providing better care, because many times these repeat visits, well, we were talking about access a minute ago. Well, some of the access is because people are coming back, and we know that's not cost effective, that's not good for their time, and it's taking appointments up that other folks might need. Yeah. So we're very optimistic about genomics. I would be remiss if I didn't mention the partnership with Suki. I'm still getting up to speed on that, but the ambient listening, I mean, this is what providers tell you. I don't want to document, you know, this is terrible. And if Suki can help really fast track that process, it's very necessary. But that to me looks like it has great promise. Oh gosh, yeah. So that's something. I know they're doing it in ambulatory. I hope they do it in a hospital setting one day too. They
will. I know Suki is working on the nurse one, so it's coming. It's coming for everyone, even us.
So that's it. We got a little bit going on. I don't know what's after that.
It's like you have a job for a while to come. No, this is awesome, Nolan. Well, we always like to wrap up these CIO podcasts talking about a little bit of career, perspective, advice. If you were talking to a aspiring CIO, what would you say to them? What advice would you give them?
How much time do we have left? It's gosh, you don't want to sound grandiose. I can just share with you, as a left brain electrical engineer, computer science undergrad guy. One of the things I had to learn is in healthcare specifically, is there's no substitute for engaging with folks. And I know this sounds so, leadership oriented, but it's true. Sure. Physicians are intelligent folks, and many times they don't work for us. So you got to be a good listener before you're a good talker.
That's good advice.
That's what I would say. I had to learn to go. I'll use a Southern euphemism for you. I do a lot of horse trading. Okay. I look for opportunities to help the physician community, or physicians, before I start asking for them to, you remember that whole CPOE thing? Just tell the doctors to enter it. They'll love it. Right? No. So and I say me, it's really my team. Right. They are a lot of great listeners before, and then we try to go back and problem solve. Love it. And then we come forward. Usually we try to come forward with, here's option A, B, and C. You can't be rigid in your approach. There is no one size fits all.
I love it.
All right.
That's some great advice. Well, Nolan, I appreciate you taking time to sit down with us here at MEDITECH Live and learn from you and your experience. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks, Nolan.
Great. Thank you. Enjoyed it.